There's a level of risk in every community and every unit. And if you worked there a while, you know what the risk is. And it comes with an agreement of how are we going to assess the risk? What is the tool we're going to use that's going to kind of put a name and a level and a number around it that's going to tell us what's the probability. This is where science of safety comes in. So what's the probability of this event? And if I have this event, how severe is it going to be? And it can be minor from a scratch all the way up into a fatality. The people in the building will know that and they can help quantify that and risk assess it. And then it has an environment. And that's the science of safety where we start talking about that hierarchy of decision making. How do you make an organization safe? You, one, try and eliminate the risk first. If you can't eliminate it and you have to live and work with it, how can you engineer it? What are the things that they can pick up and harm us with? And how do we not have those be with those risk assessed patients that are running into our unit and making that emergency department really high risk? And where do those patients then get navigated to? And how do we provide that care in the safest way? Those risk assessments, that probability definition, and that hierarchy of decision making is a skill set that needs to be embedded in this workplace violence program. And it becomes operational and simple and something that they know as well as bloodborne pathogen exposure. I know I've got to put on my PPE. Getting to that level of where safety is institutionally donning something so that they can work safely is what you have to do in workplace violence, but it's not as easy because it isn't just PPE. There's so many cultural things and there's so many layers to it, whether they're on meds or alcohol and drugs, and are they bringing in weapons? It's peer to peer, or it can be a family member that decides to show up in the ED and get angry at their spouse in the workplace. What is so challenging about workplace violence is the breadth of the definition, one of which we can barely agree on, and two, that we haven't risk assessed well together because there isn't a federal statute. You risk assess, you plan with engineering in mind, and then continuous quality check. And that continuous quality improvement process is inherent in healthcare. They know how to do that so well. So mirroring the science of safety alongside quality, we need to balance patient and worker safety. And we do that through the science of safety and risk assessing.